Mental health is often talked about in passing, in headlines, in campaigns, in political speeches, but behind the slogans is a reality that is worsening every year. In Ireland today, almost half of adults report a diagnosable mental disorder. Thousands wait months for basic counseling, and for young people, the numbers are even more alarming. Suicide attempts, depression, and anxiety at levels our society has never faced before. This video isn't about statistics alone. It's about how a generation is being shaped by housing insecurity, economic pressure, and the relentless noise of social media. We'll look at the numbers, the lived experiences, and the cracks in a system already stretched past breaking point. And most importantly, why this matters for every single person watching, whether you're struggling yourself or know someone who is. So ask yourself this: what happens when an entire generation is running on empty? Stay with me, because to understand where Ireland is heading, you need to see the scale of this crisis and the silence surrounding it. By 2025, Ireland's mental health crisis could no longer be brushed aside. Surveys show more than 40% of Irish adults now report a diagnosable disorder, while 150,000 people each year live with severe depression, among the highest rates in Europe. Services are overwhelmed. In 2024, Samaritans Ireland took 570,000 contacts, around 1,500 calls every single day. For many, those calls were the only support they had. Official systems are no better. One review found over 4,300 people on public counseling waiting lists, nearly 1 in 5 waiting more than 6 months. Experts describe the system as severely stretched, under pressure, with too many people reaching breaking point before help ever arrives. What had simmered quietly for years has now boiled over. Crisis wards are full, emergency lines overflow, and families are left scrambling for answers. The weight falls heaviest on Ireland's youth. For those in their 20s and 30s, years that should be about growth and opportunity, life has become a relentless stress test. Housing shortages, precarious jobs, and constant exposure to bleak news feeds fuel anxiety and despair. Some analysts warn this may be the first Irish generation expected to be worse off than their parents. That economic reality deepens the sense of hopelessness. The numbers among teenagers are even more alarming. A 2024 survey of secondary students found 29% rated their mental health as bad or very bad. 11% said they had attempted suicide at least once in their lives. Vulnerable groups, girls, LGBTQ+ youth, and young people from poorer families are hit hardest. One 26-year-old told the Irish Times that constant political turmoil and news alerts make it impossible to ever escape the stress. This is the portrait of a generation on edge, sleepless, anxious, and in many cases, alone. Social media was meant to connect. Instead, for many, it amplifies insecurity. By 2022, WHO Europe estimated that 1 in 9 adolescents showed signs of problematic use. Spending so much time online, it directly harmed their well-being. These heavy users were far more likely to suffer anxiety, depression, and low life satisfaction. In Ireland, with near-universal smartphone use, the effect is magnified. The pressure to perform, compare, and consume never ends. And yet, researchers caution against blaming social media entirely. Stress and despair are also driven by economic and political uncertainty. Social platforms may not cause the crisis alone, but they amplify it. Some solutions are on the table. WHO Europe recommends digital literacy education in schools, teaching children to critically engage online. Other countries have discussed restricting app use for minors. Ireland has yet to act. For now, young people navigate this minefield largely on their own. With professional care so hard to access, many turn to self-diagnosis and quick fixes. Mental health apps are booming. Tens of thousands of Irish users download mood trackers, quizzes, or digital therapy programs. But oversight is weak, and effectiveness often unproven. In one review, 19 out of 32 leading mental health apps failed basic privacy checks, and platforms abroad have faced multi-million-dollar fines for misusing patient data. Self-help can delay real treatment. One Irish woman spent 10 years misdiagnosed, her depression later identified as bipolar disorder, because she tried every online solution before seeking medical care. This DIY approach creates a mirage of progress. Forums and influencers may promise cures, but too often leave people more confused, isolated, and untreated. Ireland's mental health emergency is also a story of broken systems. Official suicide rates suggest progress. From 2000 to 2021, recorded suicides fell 28%. In 2023, the official figure was the lowest in 2 decades. But many experts warn these statistics hide the truth. Irish coroners apply strict definitions, and researchers estimate the real figures may be 20 to 25% higher. Meanwhile, hospital records tell another story. In 2021 alone, over 12,600 hospital visits for self-harm were logged, almost 1 person every hour. Rates are especially high among teenage girls, with 1 in 113 aged 15 to 19 reporting self-harm. For many, helplines remain the only safety net. Over half of Samaritans callers said the line was their only source of support. Beneath the numbers lies stigma. Polls show 1 in 5 Irish adults would tell nobody if they were suicidal. Many young people still see mental illness as weakness and remain silent. Add to this a 2-tier health system. Those who can pay for private therapy get timely care, while everyone else waits. In rural counties, queues for free counseling are disproportionately long. The result, thousands left stranded until crisis strikes. Behind every statistic is a life. Doctors describe emergency rooms flooded with young people in crisis, often sent home to wait days for a bed. Elderly patients arrive after suicide attempts with few supports once discharged. Samaritans volunteers recall callers saying they wouldn't still be here without those late-night conversations. We hear stories across Ireland. A teenager crying in school bathrooms to hide her despair. A teacher mourning a student lost to suicide. Parents describing the fear of watching their child disappear into anxiety. In 2022, official registers recorded 436 suicides. Each was a neighbor, a colleague, a loved one. The grief spreads outward, families left with unanswerable questions. What if? This is the real cost, measured not only in hospital data, but in sleepless parents, empty classrooms, and lives cut short. There are signs of movement, though too often they are small steps against a tidal wave. In 2024, the government launched a pilot counseling scheme in primary schools, later expanded to 61 disadvantaged schools in Dublin and Cork. The goal: catch problems early. Ireland also released its first national mental health research strategy, with 40 action points to coordinate reform. In 2025, an oversight group began monitoring progress, including experts and people with lived experience. Meanwhile, a new 3-year implementation plan under Sharing the Vision aims to expand community services and improve early intervention. Grassroots voices continue to push for more funding, more psychiatric beds, more training, more education. WHO has urged digital literacy in schools. Irish charities are building online resources and awareness campaigns. But critics warn, pilots are small, frameworks take years, and without a dramatic funding shift, real change will lag behind need. In 2025's Ireland, one truth is unavoidable. Ireland is living through a mental health emergency. Progress has been made in acknowledging the problem. Stigma has weakened, more people are speaking openly, and the government has published ambitious strategies. But the crisis is far from over. Services remain underfunded, families still struggle in silence, and the social pressures driving despair, economic strain, housing insecurity, and digital overload are only growing. The silent crisis is no longer silent. Ireland has admitted it exists. What happens next is uncertain. Change will demand leadership, funding, and solidarity. It will require society to treat mental health not as an afterthought, but as a priority equal to physical health. The evidence is no longer up for debate. Ireland is in the middle of a mental health emergency, and the cost of delay is measured in lives.